This bill represents a clear and present danger to the health, welfare, and education of our youngest students. I'm going to focus my remarks on the changes in the screening requirements. The bill, as it currently stands, would gut the compliance mechanism for vision, lead, and dental screening. Senator Sinclair is correct that the parents' requirement, that the requirement on the parents that they have the screenings done still remains, but it provides no means, and indeed guts the current means, the current system, for ensuring compliance. Under the current system, the parents have the screenings done, the information is reported to the local school, and from there it is passed on to the Department of Public Health. This is the most efficient way of organizing this system. The local schools are the people, the institutions who are best able to follow up to make sure that the screenings are done. The schools know who the kids are. The schools know who the parents and guardians are. The schools know how to contact the parents and guardians, whether through notes sent home, or phone calls, or emails, or parent-teacher conferences. The schools have a wide array of tools to use to contact parents and to follow up on those parents who, for whatever reason, may not get the screenings done or may not get them done timely. And I know that parents care for their kids, but some parents are negligent. And some parents may care for their kids and believe that they're responsible, but find that their schedules are difficult to negotiate. A single parent working 2 jobs just trying to provide food and shelter. A parent who has limited knowledge or maybe doesn't speak English, who does not have an established connection to the medical community. There are a whole host of reasons that parents may not be able to complete the screenings or complete them timely. The schools need to be the ones to follow up. They are the local contact point that can most effectively identify the students who need screening and haven't had it done, and they're the most effective contact mechanism for getting in touch with the parents, informing them, and encouraging them to complete their legal responsibilities. Moreover, the schools need this information in order to be able to deliver their educational services to meet the needs, the educational needs of each and every child. A student who is nearsighted is going to need a seat up front in the classroom. A school who has astigmatism problems or color blindness or a host of other possible vision problems, the school needs to know about those in order to make accommodations in the classroom. Similar concerns are involved with lead screening. Kids who have been exposed to lead have behavioral problems, they have cognitive problems. The medical literature, I won't review that for you here, the medical literature is vast. This is something that has been well understood for decades. It is why lead was required to be removed from household paints. Students who come from low-income families, who may live in low-income housing, older housing, less well-maintained housing, are the ones who are most likely to be exposed to lead poisoning. They come from the families that are least likely to have established connections in the medical community. These are the kids who are most vulnerable, who most need to be screened, but who are least likely to be screened. The schools need to be the ones to follow up on that, because the schools are most effective and because the schools need that information to give the kids the services they need. What's proposed in the bill is to cut the schools out of the flow of information. The parents are still required to do the screenings or have the screenings done, but then the parents or the provider are supposed to report this directly to the Department of Public Health. How then is the Department of Public Health supposed to follow up? A phone call from some bureaucrat in Des Moines, is that going to be as effective as a phone call from your local teacher or school nurse? I don't think so. And most egregious here is the fact that the bill removes the requirement for the schools to report to the Department of Public Health the list of kids who are enrolled in kindergarten. So under this bill, the Department of Public Health won't even know who they're supposed to follow up with. They won't know what students are enrolled. They will get the notice from the kids, or regarding the kids who have been screened, but they won't know who haven't been screened. They won't even know that they even exist. The Department of Public Health will not know who the students are. They will not know who the parents are. They will not know how to contact the parents. They will be completely unable to follow up in any kind of effective or meaningful way. There is a fiscal note here. The fiscal note says it's going to cost the Department of Public Health $1.2 million in the first year, and they estimate $850,000 in the second year. The fiscal note observes that there may be some local cost savings, but they're unable to estimate what those might be. So the bottom line here is that this bill shifts power and responsibility away from the local officials and instead centralizes power and responsibility in Des Moines, in the state government, in the Department of Public Health. It centralizes power and responsibility, it increases state costs, it dramatically reduces efficiency in collecting the information. With the amendment that we just adopted, it does provide some cockamamie backdoor scheme for information to be provided back down to the local level, but only if parental consent is achieved. No mechanism was offered with that amendment as to how the Department of Public Health would achieve or secure that consent. To call this a Rube Goldberg scheme is an insult to the late, great Rube Goldberg. At least his schemes, as crazy and convoluted as they were, they had some chance of working. This has no chance of working. So I'm really quite befuddled as to why we're looking at this. A bill that shifts power from local to the state, shifts responsibility from local to state, increases costs and decreases efficiency, and worst of all, denies or makes it much more difficult for schools to get the information they need to help out these kids. It's lose, 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 lose all the way down the line. We have to vote against this bill.
The chair recognizes the senator from Lynn, Senator Mathis.
Thank you, Mr. President and colleagues. From a health and human services perspective, I would ask you to take a look at this, and I think Senator Miller-Meeks may know quite a bit about this. I think this bill looks at screening and testing as a transaction and not an integrated response to children's health care. So right now, there's a trend on examining what the social determinants of health are. Those involve the look at where people live, where they go to school, where they play, where they work, several things around that, including poverty, how people grow up, social determinants of health. I believe that when you separate the school from that, although the school will still have the children who are tested there, and that those statistics go to the public health department. How is the public health department working with the school and with other collaborative agencies to improve the health and well-being of that child? I think we are trying to figure out who's going to pay for this, how we're going to, how the data is going to be collected. But we really have to look at, the bottom line is, how does this improve the health of our children across the state in a holistic way for wellness? Again, the social determinants of health. How would this advance our integrated health homes, our pediatric integrated health homes that we've worked so hard to get children to their doctors, school children to their doctors, and satisfy their needs around not only dual diagnosis of a health care and a mental health issue? This doesn't really plug into that. This almost stands alone from that. We have no plan on the back side of this to do this transaction. We're also, as you know, in the Children's Mental Health Bill, we're taking a look at universal health screenings, universal mental health screenings. How would that be integrated into all of this? It wouldn't, because you're separating the school from what needs to be solved around a child's overall holistic need for us to help them. And for that, I would urge the body to reject this bill.
The chair recognizes the senator from Polk, Senator Celsi.
Thank you, Mr. President. Oh boy. This bill stinks to high heaven. This is basically the kitchen sink of all bad things that could happen in public schools. So we're supposed to allow school boards to have local control over everything, which is basically the opposite of the trend that has been happening in this body for the last 3 years. But all of a sudden, we really care about having local control. So when you allow local control and you lower the bar at a state level, what message is that sending? To me, it sends the message, go ahead, lower your standards. When we gutted collective bargaining a few years back, we said, oh, they still have the right to put everything into a handbook or still bargain on stuff if they want. But over 130 school districts gutted their teacher contracts, leaving our teachers to flee the state in many situations, not get a raise in others. It seems like in a time when many schools are coming to the realization that students need these health screenings and wraparound services with community partnerships like Delta Dental, local businesses that would like to help, we're encouraging them to go in the exact opposite direction with this bill. Why change the law? We're allowing the bar to be lowered. The only people that will suffer are the kids. In an atmosphere where funding is being cut and services are being curtailed, in a 2% atmosphere, that is what's happening. You can just go ask your local superintendent if 2% is enough. They'll tell you, no, it's not. We shouldn't be lowering the bar. This IASB kitchen sink bill, this is their one chance to lower the bar across the state without accountability from local school boards. They'll just say, the state said it was okay for us to do this. Thank you.
Seeing no further discussion, the chair recognizes the senator from Wayne, Senator Sinclair, for final remarks on Senate File 438 as amended.
Thank you, Mr. President. I truly find the response...
Excuse me, Senator. I guess Senator Dotzler had put his name in. It didn't flash up on my screen, so the chair recognizes the senator from Black Hawk, Senator Dotzler.
Thank you, Mr. President, for your indulgence on that. I might have been a hair late. But I just wanted to give a real example about the effects of lead paint and the lack of screening requirements that we have in this bill. You know, this is a very serious subject, and I've been working on this and trying to maintain these programs and actually add to them since I was elected in 1996, when Black Hawk County had the highest number of children in the nation, not in Iowa, but in the nation, affected by lead-based paint poisoning. And I had a nephew through marriage who, at a very young child, before, while he was in kindergarten, started nibbling on paint chips from the house that he lived in. They were a very low-income family, and in a rather old house. And as we know, the older homes, especially in poor districts, had a lot of lead paint. Well, he wasn't tested, and because of that, they started noticing behavioral problems. And he acted out in school. It kept getting worse. Finally, they did test it, and his levels of lead paint were through the roof. Well, he was permanently damaged because of the lead paint. The behavioral problems continued through school. He had to have special care all the way through grade school, into junior high, tossed out of school, ended up committing crimes, wrecking cars. It went on and on, spent time in prison. As an adult, thought he got back out of that mode, back into prison, and it went on through his whole life. Alcoholism and a whole variety of different problems ensued. I think back on what would have happened to this person's life if they would have known at a very early age that he had been infected by the hazards of lead in his blood. We can prevent this type of life and career problems by making sure and ensuring that young people have these lead-based paint tests. We're going to save maybe a few dollars here and there by just allowing the parents to take care of it, and honestly, his parents never did. A lot of times low-income people aren't aware of the situation in their homes. We would have saved hundreds and thousands of dollars just on this one case for the time he spent in prison, by the time, all the times that he had in courts across my district. This doesn't make any sense. And I think of all the things that this bill does, this is the absolute worst possible thing that we could do to ensure the health and safety of young students in the state of Iowa. It is the worst thing that we could do for their long-term health and for their long-term responsibility to society, because lead-based paint will affect them, and lead poisoning in water and a variety of different methods of ingesting lead can have a devastating effect on a person's biology. So I would hope that we reconsider this piece of legislation and at least fix this part of it. So I would hope my members would vote against it. I thank you for your allowing me to speak there, Mr. President, and I thank you.
Chair recognizes the senator from Dubuque, Senator Jochum.
Thank you, Mr. President. Mr. President, members of the Senate, just to follow up on what Senator Dotzler was talking about, more than half of Iowa's housing stock was built before 1950. and have high levels of lead paint. We know that lead has a very negative impact on the development and the neurologics of children, especially under the age of 6. What I do not see in the fiscal note is what the impact of not doing the regular lead testing on children will have on special education in Iowa. It will cost tens of millions of more dollars. But even worse, far worse than the economics of it, is the lost potential of children. And I think that Senator Dotzler articulated it very well in just one example of someone who had neurological problems because of lead paint and ended up in our prison system. Members, please, this is about our children in school. I was one of those kids that did not even realize that I did not see well until my vision was tested in school. How would I know I did not see well when the only way I ever saw things was because I had a vision impairment? But I was one of those lucky kids. Yep, I was that A student and did well in spite of it, but would never have known that I needed eyeglasses until I was tested in school. We are moving in the wrong direction. Perhaps Senator Sinclair will share with the body what she believes are going to be the additional costs in special ed if children are not tested on a regular basis for lead poisoning, because I do not see this in our fiscal note. Thank you, Mr. President.
The chair recognizes the senator from Johnson, Senator Wahls.
Thank you, Mr. President. Ladies and gentlemen of the Senate, for the information of the body, I want to simply share a little bit of information from our state hygienic laboratory about the prevalence of lead levels in newborns in our state. I think it's easy to think that this is a problem maybe only in Black Hawk County or maybe only in Dubuque, but the reality is this is a statewide problem that affects both rural and urban Iowans. A recent study found that, in fact, 1 in 5 Iowa newborns is born with a level of blood lead that is higher than the CDC's actionable blood lead level of 5 micrograms per deciliter of blood. Now, there's a strong association between growing up in a home built before 1950, as Senator Jochum just mentioned, and having this level of blood lead that is not safe. There is, and again, the CDC, there is no safe level of blood lead at all. 0. A lot of us think about blood lead as being a problem that we hear about in Flint, Michigan because of pipes. But there's a huge amount of lead in our built environment all around us, and ending the requirement for school districts to test for blood lead, I believe, and I agree strongly with Senator Quirmbach, Senator Dotzler, Senator Celsi, and Senator Jochum, is going to have the biggest negative impact on folks who are not aware of the dangers of lead historically or currently. And again, this is, even though these were sources of lead in our environment from the past, they are still with us today, which is why 1 in 5 Iowa newborns born in 2017 were born with a blood lead level that was, according to the CDC, not safe. And so while I can certainly understand wanting to trust local school districts to make a decision, the reality is that if a school district has to make a choice in the name of trying to save some money, which I believe is part of the intention of this bill, and they choose not to make this investment in blood lead level testing, I fear that we are going to all wind up paying a much greater price, not just in dollars, but in human costs down the line. I also want to make sure the body is aware of the longer term effects. Senator Dotzler provided an anecdote, but the science is very clear about this. When you see blood lead levels that are higher in the 3 to 4 microgram range, the 4 to 5 microgram range, you're associated with reduced reading scores, reduced math scores, a higher chance of being classified as having a learning disability in elementary school. And to go beyond just your early years, by the time you become a teenager, teenagers who have had high lead levels in childhood, much more likely to have had sex by the age of 13, to be pregnant by the age of 17, to smoke and drink while they're in their teenage years. Connection to crime. So we no longer allow leaded gasoline. We no longer have leaded paint, but there's still a huge amount of work to do in cleaning up our state and cleaning up the country. More than 3 million miles of pipe leading from water mains to homes contain lead. And so this is not a problem that has been solved. It is a problem that requires continuous work. And I strongly urge the body to reject this bill and to make sure that we are protecting the water, protecting the environment, that our kids grow up and play in, and that we're testing them and getting them the treatment they need through our school system if they need it. Thank you, Mr. President.
Seeing no further discussion, the chair recognizes the senator from Wayne, Senator Sinclair, for final remarks on Senate File 438.